Good day everyone, I am Andre, your science nurse for today, and today I am going to perform and demonstrate the evaluation checklist performing the intravenous therapy. So, what is intravenous therapy? Intravenous therapy is the insertion of a needle or catheter or cannula into a vein based on a physician's routine prescription. The needle or catheter or cannula is attached to a sterile tubing and fluid container to provide medicine and fluid. The purpose of intravenous therapy is to maintain correct dehydration in clients unable to tolerate sufficient volume of oral fluids or medicine, parenteral nutrition, administered drugs, transfusion of blood or blood components, to provide a lifeline for rapidly needed medication or blood. The first thing we're going to do is we're going to check the solution and compare it to the doctor's prescription. So, for the type of the solution, the amount of the solution, and for the percent of the solution and the flow rate of the solution. And then we're going to introduce ourselves to the client, explain what we're going to do, why it's necessary, and how the client can cooperate. Good day, sir. I am Andre, your science nurse for the day, and today I am going to do your intravenous therapy. This is necessary, sir, to give inadequate hydration and for you to have line for the easily need of fast medication. But before that, may I ask your name, please? And your age, please. Yes, sir. Sir, please do cooperate with me when we are doing the procedure. Thank you, sir. And then we're going to perform hand hygiene and observe for other appropriate infection control procedures. And we're going to provide for our client's privacy by drawing the curtain and closing the door in the room. And now we're going to prepare all the equipment needed. We're now going to prepare our client and select for the venipuncture sites. So we're going to ask the client to sit on a sitting position or lying position on the bed. So we're going to ask the client if she or he is comfortable on his position. Sir, are you comfortable on your position right now? Yes, sir. And then we're going to ask the client to expose his lip on his non-dominant hand, where we're going to assess for the sides. And then if the client or patient is early, we're going to check for the agency protocol regarding shaving, and we're going to place a towel or linen protector under the client's extremity. We're now going to dilate the client's vein. So we're going to place the client's non-dominant arm on a dependent position, and we're going to place a tourniquet 15 to 20 centimeter or 68 inches above the client's venipuncture site. And then we're going to tell the client that the tourniquet might feel tight. Sir, I'm now going to place the tourniquet, and it will be going to tight a little. And then we're going now ask the client to clench and unclench his fist, and we're going to tap the veins. Sir, can you please clench and unclench your fist, or pagin mo isa at po fist niyo po. Thank you, sir. And then if the being less distant, we're going to remove the tourniquet, and we're going to apply a warm moist towel for about 15 to 20 minutes. So we're not going to wear or apply a clean gloves, and we're not going to clean the venipuncture site using a antiseptic swab, and we're going to clean the skin or the venipuncture site up and then or back and forth, and for at least 30 seconds. And we're going to allow the skin to dry. And then we're now going to prepare the solutions and the IV tubing. We're now going to insert the catheter and initiate the infusion. So we're going to remove the needle from the external packaging. And then using my non-dominant hand, I am now going to tote the client's skin, and I am going to place the needle 15 to 30 degrees angle. So I'm now going to insert the needle. So I'm now going to insert the needle until it reaches the client's vein. And if the lumen of the needle has already blood, I'm now going to proceed and until I reach the venipuncture site. If hematoma occurs, we're going to remove the tourniquet and remove the needle and apply pressure to the venipuncture site. We're now going to remove the tourniquet on the client's arm to allow pressure to the venipuncture site and to reduce or eliminate the blood into the catheter. And using the index finger and thumb or non-dominant hand, we're going to stabilize the tab of the needle. And then we're now going to remove this stylet and place it to the on a container. And then we're now going to insert or connect the intravenous tubing to the needle. And then we're going to maintain sterility, and we're going to adjust the flow rate or as what is prescribed to the doctor's prescription. We're now going to address the venipuncture site. So, if Tegaderm is available, we're going to use it and to protect the venipuncture site, and or we just can simply put tape on the client's skin and on the IV tubing to secure the venipuncture site to the client's skin. And or we can use a protector if it is available, or because it's only for the pediatric patient. So we're now going to label the venipuncture site using the or according to the agency policy. So we're going to put the date and time, the type, the age of catheter use, and for the initial of the nurse. So we're now going to discard all the disposable equipment that we have used on the proper subtacles, and we're going to clean the blood if there's any spill out to the linen or anywhere. And then we're now going to remove our gloves and document our findings in the client's record. And if there's any variation from normal findings, we're going to report it immediately to the client's physician. And after removing the gloves, make sure that we're going to perform hand hygiene. For the discontinuation of the intravenous catheter or intravenous infusion, the first thing we're going to do is we're going to stop the infusion. And then we're going to tone the skin in removing the connecting of the intravenous set from the needle. And now we're now going to remove the intravenous catheter and apply pressure. Take note that we're going to discard the catheter on the prescribed or appropriate trash bin. And then we're now going to document the procedure, assessment data, and the client's response. So of course, the date and time, the nurse name, the site of the location, the type or size of the catheter used and number of attempts, the type of dressing, the type of the solution used, and the patient's response to the intravenous therapy. And then we're going to also provide health teachings that the clients need. And if there's any variation from normal findings, don't forget to report to the client's physician immediately. And then we're going to observe for the kinds of skin irritation or skin integrity, and if there's any specific adverse reactions by the client. Thank you for listening. Have a good day. God bless. Keep safe.